Hello, welcome to Pediatric Pulse. Today we are going to explore the management of bradycardia in children. Bradycardia is a condition characterized by slower than normal heart rate, and this can be a significant concern in pediatric care. Understanding how to effectively manage this condition is essential for ensuring the well-being of our young patients. Assess the child with the ABCD approach and ensure that you recognize and treat the reversible causes. Those are the H's and T's. Then administer oxygen if the SpO2 is below 94%. Assess the respiratory rate, heart rate, capillary refill time, do cardiac monitoring, assess the blood pressure, assess the AVPU scale, ensure that you have a vascular access, either intravenous or intraosseous. Are there any signs of circulation? If no, follow the advanced life support algorithm. If yes, is it compensated? For compensated, you will have normal loss of consciousness, plus or minus respiratory distress, signs of respiratory compromise, and the blood pressure will be more than the 5th centile. Monitor for clinical deterioration and ensure that you seek expert help promptly. Treat the cause. If it's bradycardia, consider oxygenation and vagal tone. If it's supraventricular tachycardia, consider vagal maneuvers. For example, use of ice packs or carotid massage, among others. Then reassess the child and consider use of adenosine. If it was decompensated, seek expert help promptly. Ensure that you also assess for signs of vital organ perfusion compromise, which are reduced loss of consciousness, tachypnea, bradycardia, tachycardia, and the blood pressure, which is below the 5th centile, capillary refill time of more than 2 seconds, and weak or impalpable peripheral pulses. So for bradycardia in children, for children who are below 1 year, the heart rate will be below 80 beats per minute. And for children above 1 year, it will be below 60 beats per minute. For treatment of bradycardia in children, do optimal oxygenation with positive pressure ventilation if necessary. For the unconscious child with the heart rate of below 60 beats per minute, despite oxygenation, start chest compressions early. No response to oxygenation? Identify other causes and treat accordingly. If it was vagal stimulation, administer atropine. If no response to oxygenation and atropine, consider the use of adrenaline. Remember, pacing is rarely used, and it is usually guided by etiology. If the cause of your bradycardia was vagal stimulation and you want to administer atropine, here are the dosages of atropine in pediatrics. Up to 11 years old child, we use 20 mics per kg. For children between 12 to 17 years, we administer 300 to 600 micrograms. Larger doses may be used in case of emergency. No response to oxygenation, no response to atropine, and now you want to administer adrenaline. For bradycardia, we administer 10 mics per kg in children, and usually repeated if necessary. Thank you for watching. See you in the next video.